Obviously, if you're here tonight, you have probably thought about having a career in healthcare. And as we know, health is something that all of us experience from the moment we're conceived all the way until the moment we leave this earth in whatever form. So health, a career like this does span all ages. So there's occupational therapy assistants and physical therapy assistants that work with really newly born, newborns, neonates as they're called, all the way up to people who work in palliative care, people who work in long-term care with people in advanced age. So there's all ages, and you can imagine, and we'll talk a little bit about it more, but all sorts of different illnesses and injuries and conditions and challenges all along the way. So somebody who makes a good therapist assistant is somebody that wants to help another person improve their quality of life. It's a team-based atmosphere. You're working with other physios, speech language pathologists, doctors, nurses, dietitians, respiratory therapists, all sorts of the healthcare team. And after a day of helping an individual in a recovery situation or whatever the condition is, it is a profession where you do get a sense of giving back, and you get a sense that you're making a difference. Not necessarily with every single client, because there's ultimately a person's recovery belongs to themselves, but there's definitely lots of daily rewards with a profession like this. So at OC, it's a 2-year program, and as I said, I'm actually new here. I've been a practicing occupational therapist for the last 15 years, and took a job at the college this past September. But as I'm learning, it's a 2-year program, and right now I have first-year and second-year students. I had classes today for both first-year and second years. My second year's class today was a pediatrics class where we're looking at developmental disabilities. We're looking at autism spectrum disorder. We're looking at developmental coordination. We're looking at all of the primary reflexes that a baby is born with. So really interesting in second year. And then my first year class was kind of a boring one, and it was all about documentation and how to make sure that when you're writing medical records, because they're going to be a part of the legal record, that how careful you have to write your records. So I tried to make the documentation interesting by making a little song about it, but ultimately it's hard to make something like that interesting. So in addition to so it's a 2-year program, 4 full-time semesters. Your summers are off, and you're not in school during those times. And then towards the end of both your first and your second year, you have these practicums or practicas or practical experiences where you're out in a clinical setting. And those settings range, as you kind of heard on the video. You might be in a hospital, you might be in a school system, you might be in a private clinic, all sorts of different options. And obviously, as they said in the video, when you graduate the program, you become qualified to work as a therapist assistant, and a therapist assistant work is a physiotherapist, with an occupational therapist, or with a rec therapist. Just something around rehabilitation, right? As I kind of mentioned before, helping somebody attaining their fullest potential and the wonderful rewards that can come with that. But it's not just someone's bone and muscle that's been injured from an accident, right? It's OTs and OTAs, OT assistants, graduates from this program, going to work in mental health. We're going to work, within the social care system, working with individuals who are underhoused and who have health challenges, as well as perhaps being underhoused. Obviously, the physical rehabilitation is part of it, as well as something called vocational, which is kind of helping an individual getting back to work, or helping an individual find a particular type of work that might suit them now that they have this added, physical or cognitive challenge. just listed a few there of the conditions that people might encounter working with. You can just go back one slide. Yeah, thanks, Terry. So there's orthopedic conditions like hip and knee replacements and fractures, strokes, acquired brain injuries, spinal cord injuries. These are some of the client population types that you're going to encounter. Diseases that are associated with aging, and as I said at the beginning, all the way from birth all the way up to the end of someone's life is the span of the potential clients you're working with. Yeah, you can see there at the bottom too some of the mental health challenges that people live with. So again, if you don't know what physiotherapy is, it's using physical treatments to improve someone's function and independence. And OT also has a lot to do with independence, but it tends to be more of those activities of daily living. Teaching somebody, for instance, to get dressed after they've maybe have a lower leg amputation, or they have an upper extremity injury, and they're still wanting to, assist with, maybe they're a new parent. Maybe they fractured both the wrists and they're a new parent. An OT would be involved in helping that person still carry out the duties of being a new parent in terms of helping, maybe with childcare and, all the things that come in with that, while living with a temporary injury of both wrists. So you can see there in the picture, that's an individual, that's an OT working with an individual and making a splint for them. Maybe they've had a laceration from doing the dishes and a wine glass breaking in the dishwater and cutting one of their tendons, then undergoing some surgery to have that tendon repaired, and then working with an OT closely who would design a splint. And the OTA would be instrumental in that process, making sure the Velcro is attached properly, making sure if it needs to be modified, it can be. So yeah. And then rec therapy. Recreation, we all know what recreation is. It's certainly what makes me tick. And using recreation, like, when we think of kids, the only occupation that a child has, for the most part, at least in the developed world, is play, right? And so a lot of recreation therapy is using play with kids as well as with adults, in turn to promote, self-esteem and, also work within the person's physical challenges. As I said in the video, there's a lot of different areas where a therapist assistant might work in hospitals and surgical clinics and rehabilitation centers and psychiatry and in and outpatient clinics, where maybe the individual's living at home and then they come into the clinic for a period of for a few hours of rehabilitation and then go back out to their own home. Yeah, and here in Kelowna, we have a few multi-level care facilities. So there's apartments that have individuals that live independently, and then there's other apartments where an individual can get a bit of scheduled care or assisted living, and then all the way to individuals that need 24-hour care or long-term care. And that's definitely a site where a therapist assistant would be working nowadays. Community care is another aspect. So every day there are OTs and OTAs and physios and PTAs driving around the Kelowna community, visiting individuals in their home, checking in on them, checking on their medical equipment, their wheelchairs, their hospital beds, their maybe there's ceiling lifts. There's these machines that kind of can lift an individual if they're not able to get out of bed themselves, and all that equipment needs to be installed and moved and checked on, and that's a big role for a therapist assistant in the community, working for a community agency like Interior Health Community Care, or also for a private clinic such as creative therapy or LifeMark or Meridian or something like that. Also, for the children, if you're going to work with children, you're going to be at the child development centers, and in private practice. Most of us are pretty familiar with physio clinics, but there's also lots of private OT clinics as well. So this is just a testimonial from one of the supervisors on the practicum. I'll let you read that. Okay. And yeah, a couple of pictures here. You can see a student there making an adjustment to a wheelchair. Certainly a skill that our students acquire when they're at school. In the school portion, I do lots of that work with the students, and then when they are on their practicum, they're often involved in that type of work as well. So, if you're not a handy person, that's okay. Don't be don't be afraid. You learn the skills. And then if you happen to be kind of a handy person that's good with tools, well, you're going to excel in that area, and you're going to find a job lickety split, because there's a huge need. Okay, so I guess the following slides are just a bit of an overview of some of the courses. So there's some university transfer courses. So if you're coming right out of high school, then there are these university level or university transfer courses, they call them. So you'll be taking this, and they're at Okanagan College, but they're biology and psychology and English. So those are requirements. If someone's coming into the program from already having done some university training, then it's possible their previous training can be counted and credited towards these the programs there in blue, biology, psychology, English, and they won't have to complete them. But if you're coming right out of high school, you got to do bio, psych, and English. And then you can see some of the courses. I teach that communications and group processes course. There's Recreational Therapy 1, Client Care Introductory. That's what I teach on Mondays, and we have a lab. And this beautiful new building that we're teaching in at the college, and that's where I teach the fundamentals of patient transfers, the introduction to wheelchairs and how to fix them and how they kind of operate, hospital beds, how to roll somebody in bed, how to transfer someone in and out of bed, all that sort of stuff. So and also just how to interact with a client, how to gain consent, and all these important factors. And then you can see there for summer semester, that's the practicums when a student is out. So you see kind of September to December, and then January to April, and then May to June. Those are kind of the three kind of pieces of the program. Just a little bit more on the practicums. It's during those practicums that you apply the knowledge that you've learned in the classroom. Okay, another testimonial here I'll let you read. Great, and that comes from a first-year student who went out on their practicum and had a good experience and was happy that she or he felt prepared. So again, this is the second year of the program, so semester 3 and semester 4, and you can see there's all sorts of stuff: psychiatry and mental health, and gross anatomy and kinesiology, client care advanced, therapeutic modalities with the physiotherapist Brett, and then physiotherapy 3, OT 3, and then there's a capstone project. And then you're off on then you're done all your schooling by April, and then you're off on your last practicum, and then you graduate after that practicum in early July. Yeah, that's fine. So general goals of the program, the instructors, we demonstrate good safe practices, and then that's you're gonna observe us doing that, and then you can apply that into clinical settings. And the students are gonna demonstrate professional behavior and attitudes and effective communication with individuals. And also we do a lot of group work, a lot of group running of groups. So you're responsible as students to kind of orchestrate a group and to plan a group and then run it for the class. Because that, again, that's another common role of an occupational therapy or physiotherapy assistant working in the community. And obviously, organizational skills and problem solving are all great attributes. We're going to learn skills and, again, transfer those skills in the clinical setting on the practicum. And there's a bit more information online. There is a therapist assistant diploma program website, so you can get more information there if you're needing it. And you can see your academic admission requirements and things like that. And again, there's just lots of places to find more information through Okanagan College. And yeah, just wanted to say thank you very much. And it looks like that you're eligible to win up to $5,000 tuition credit at Okanagan College just by entering this giveaway. Wow, that's amazing.